Almost a year, UK healthcare workers have been advocating for House Bill 31. And this bill would provide at-home blood testing machines to Medicaid patients on blood thinners.
And those healthcare workers finally got the help they were looking for from Governor Beshear last week. WKYT's Alyssa Williams has more.
For Medicaid patients across the Commonwealth that are on blood thinners for various reasons, a weekly trip to the doctor's office to test their blood is usually mandatory.
A lot of patients on Medicaid live in very rural areas, so they would have to drive an hour or so to get to the hospital to have their blood checked.
But this won't be the case for much longer with the passing of House Bill 31, something healthcare workers Amanda Crabtree and Dr. Tessa London Bounds have been advocating for since July of 2023.
Our local politicians have been essentially very supportive, and it was voted unanimously that it was appropriate, and it was an unprecedented amount of time that it took for us to actually pass that bill. Nothing in politics seems to move that quickly.
House Bill 31 will allow those Medicaid patients to have at-home machines that will test their blood.
Here's a machine that a diabetic uses to check their blood sugar, and that's very similar to what these home INR machines look like. Medicaid is state to state. And so I hope that since Kentucky has done this, other states will follow suit, and Kentucky can kind of be the model for the rest of the country to give patients access to this great monitoring system.
And how does it feel to be a voice for your patients and now know that your voice has been heard?
It's something that allows better access and a more equality for our patients of the Commonwealth. And I think that being a voice for those patients is extremely important, and it's our duty.
Alyssa Williams, WKYT.
And Crabtree says now that House Bill 31 has been signed by Governor Beshear, those Medicaid patients could be receiving their at-home machines as soon as this summer.